Welcome to yet another episode of Movement Medicine. Firstly, we'd like to thank our partners, Fit India Movement, thank you so much. Then Back to Fitness, the clinic I run. Lal to the High, the race that I've been putting together in Ladakh with a lot of my colleagues and friends for the last 10 years. And then the movie that's being made on the 10th edition of Lal to the High called Moving Mountains Within. Now, today is a special edition. We have Dr. Madhumathi Sanjay from Hyderabad. So, welcome, ma'am. Welcome on board.
Thank you, Rajat, for having me over.
So, ma'am, jumping into right away into your academics and your professional background so far, what have you been up to so far? Please share that with us.
So, I'm basically an obstetrician gynecologist now. So, let's say to start off right from my schooling days, we were moving cities every 4 5 years because my father was in the government service. So, schooling was somewhere in Delhi, Bangalore, Chennai, all these cities, and then I went back to Bangalore to do my medical schooling. I did my MBBS from Bangalore and then went to Gulbarga, did my MD there. I did my master's in obstetrics and gynecology, and then came down to Hyderabad to settle down because I got married to a person in Hyderabad. And I've been in Hyderabad since then, so that's since '95. And now I'm a senior consultant obstetrics and gynecology in Apollo hospitals. I've been with them for the last 20 years, and it's been a lovely journey. I've enjoyed my stay here in Hyderabad. And Hyderabad's become my city. I was new to Hyderabad in 1995. And my main interests are high risk obstetrics, that's my forte, and adolescent gynecology. I am also a member of the Obstetrician and Gynecologist Society of India. Also, we have a society called the ISOPAB, or the Indian Society of Reproductive Biology and Perinatology. I am the president for the Hyderabad chapter presently. I am also the South Zone coordinator at the national level, and I'm pretty active academically and practice-wise. So that's me professionally.
Thank you for sharing that, ma'am. Now, coming to your personal, your activity, physical activity, your sports background, have you always been active or did you pick it up later? Did you play sports in school or was it after medicine that you picked it up?
So, sports, okay, let's say if we look at my school days, there wasn't really any organized training or sports or even team sports event that I was part of. I was usually this girl who took part in the debates and the songs and the dances. And of course, I come from a generation which did not really have television or tablets or smartphones. So obviously, we would go out and play. There would be a lot of playing around in the evenings, like any other school child those days. Cycling around the locality, all through summers. Maybe swimming. Somewhere in high school, I got into swimming. So there's really no structured pattern of sports, or not much interest also in it. One thing I did in my 11th and 12th was I was part of the NCC in Chennai, and then went on to become the Tamil Nadu Best Cadet for that year, and also got selected for the RD parade. But then obviously the usual reason given by the principal that no, you're in 12th and you cannot be going off to the RD parade in Delhi. So that's where it all stopped, and went on to MBBS, and not much. I mean, barely any sports activity or sports related activity at all. Even through my MD, and that's how. And then I got married, and I started practicing in Hyderabad. And life just went on till I think some stray remark by a couple of my friends who said that. I think you need to start doing something. You are steadily gaining some weight. And I must have been about 60, 62 kgs then. And that set me thinking. I said, okay, these guys are telling me that I need to lose weight. It really must be something. And that was a generation when there wasn't really any size zero concept those days, but I was still gaining weight. So that's how I started off my journey in this whole fitness, joining the fitness bandwagon. It basically started with just morning walks. I would just go to the parade grounds and go for a morning walk, maybe an hour or so. And then one fine day, a senior citizen, a gentleman came up and told me that you're a youngster, you should be jogging, not really walking. Walking is for us senior citizens. So I said, okay, all right, let's start jogging also. So I used to do some kind of a jog, walk kind of a scenario. And meanwhile, I got pregnant. But then what I did through my pregnancy was I continued to be absolutely active. I would go for my morning walks. I did all my antenatal exercises according to the trimesters and had a safe, healthy, normal delivery. And again, post delivery, within 3 weeks, I was back in parade grounds, back to my morning walk. So that was something which kind of stuck to me. The kind of routine to do some kind of a physical activity every day, come what may. So through my kid being a toddler, from walks in parade grounds, it became stroller walks, and all that continued. And then I think sometime when I was around 35 or so, I joined a gym. And again, it was just a colony gym, so no structured training. But then I did whatever I thought I could, and strength training, functional training, all of that. And I enjoyed every bit of it. And this went on, and maybe for the next 6, 7 years. So I was just this gym person. I wasn't doing any much of outdoor activity, right? And then sometime I think my nieces and nephews were all busy doing the Himalayan treks, and I said, okay, this sounds interesting. It looks good. It looks beautiful. Should go there at least once and see how it is. I really didn't think I could survive a tent and living in the outdoors. I said, let me just give it a try. Let me do a short trek. But then what happened when I signed up for the trek was one of their criteria to let me in is that I should be able to run for at least 4.5 kilometers in 30-35 minutes or something like that. Again, I had this misconception that if I go and run out on the road, I'm going to totally mess up my knees. And I also had a small lower back issue, which was a result of a very freaked out accident at college. So I was skeptical about running on the road. So I ran on the treadmill itself. I completed and met the criteria for the trek, and I went on the trek. I enjoyed my trek totally. But then I also met a lot of them who were into running and running marathons, half marathons. There were women my age who were, training to debut that very year. And this really inspired me and got me thinking. I said, oh my God, so it's really not such a bad idea to be running on the road then if so many people are doing it. I was so ignorant about marathons that I didn't even know that my city itself was hosting one of the most prestigious marathons of the country. I was absolutely ignorant about this whole sport in toto. So anyway, I got on to running, and slowly in 2014, I debuted and I did my first half marathon. I ran in Bangalore. I thought if I'm running for the first time, I should run in the city where I was brought up or where I grew up. And I loved it. I loved running on the roads where I had spent my college days and school days. And it was a lovely experience. And that was 2014, and I had trained all on my own. In fact, I had a classmate of mine who was in Bangalore, and virtually he would be training me. "Theek hai, aaj itna karo, tomorrow you can run this much." And it was all very wishy-washy kind of a thing, but it was good. I mean, I anyway ended up doing that 2 hours, 57 minutes, nothing much to brag about, but then I completed it, and that was what was great. And and at an age of 44. I started running at 44. And then the following year, I joined Hyderabad Runners and started running with the Secunderabad Runners because I live in Secunderabad. And I totally love it. I love the training sessions. I love the camaraderie that came along with it, meeting so many people from different walks of life. I think that's something you really look forward to because you're so used to meeting, friends from your own fraternity that this was really refreshing. And that's how my journey into running started. So half marathons went on to full marathons. I debuted in 2018 and also did a 50K last year in Malnad. I turned 50 last year, so I said, let's do a 50K. And that's how the running journey has been. But then what I also picked up along the way is a lot of knowledge about how to make it a holistic training, not to just, stick to one form of activity. So I included, got on to cycling, got myself a cycle, got on to cycling. Swimming was always there, and I still go back to my gym. So I haven't stopped going back to the same gym that I joined, about 10, 12 years back. And I go there at least thrice a week and make sure that strength training is very much part of my training. And also, having given up of my trekking, I still go at least once a year. And I love the feeling of going to the Himalayas and coming back. And I still continue doing that. So that's how my journey has been. And I've enjoyed it. I'm enjoying it rather. So that's that.
Brilliant.
That's fascinating, isn't it? You picked up running, physical fitness at the age of 44, and you're carrying on better than ever at the age of 50. Doesn't that cater to the misconception out there in the society that, age, oh my God, don't do this, don't do that, and 50 is too old? What do you have to say about that now?
Totally. I think it's an absolute misconception. This whole thing about once you age. I mean, let me tell you, somewhere when I started running initially, in 2014, I started running. By 2016, the initial enthusiasm of getting into long distance running, I had my share of injuries too. So much so that initially when I went to my colleague in the hospital, he literally looked me up and down and said, "Do you really have to run now at this age?" And believe me, I mean, this person has been treating well-known sports persons of our country. So, coming from him, it did sound a bit condescending or rather very discouraging. And I really thought, I mean, what am I doing there? But then thankfully, back in my group itself, we had good coaches, and also we had doctors, rather orthopedic surgeons who also run. And then they kind of encouraged me and said, no, there is okay, fine, you're injured, you give it some rest, you do your rehab and you will recover and you'll be back on your feet. There's really nothing to get so scared about. And that helped. All that encouragement and the wisdom helped, and it's been no looking back since then. I mean, I recovered and I'm here, so I'm good. So yes, age is just a number. I mean, you can pick up whatever sport or activity or interest that you have at any age. I mean, why should age be a number? I mean, age be the criteria for one to decide what to do and what not to. As long as you're taking it slow, obviously you shouldn't be jumping into it with over enthusiasm and then get yourself injured or something. But then there is a manner and a method in which you can slowly step up your activity, whatever it may be, whether it's cycling, swimming, running, yoga, whatever. Start slow and then slowly build it up. And I don't think age is going to be a factor which is going to keep you back.
Excellent for sharing that. Now, please tell us and the audience about the importance of strength training, whether it be for sports, running, fitness. How important is strength training for you?
I think strength training is a good thing. I mean, if you're, okay, let me talk about running because that's what I basically do. So if I am running every day, maybe logging in miles every day and not really taking care of my strength training, running is a repetitive, action. So that any repetitive action is going to obviously cause injury. That's the first thing. Unless you also strengthen those muscles that you're using. And it's not just the leg muscles we're talking about. We all know that as runners, we have to have a strong core and a strong upper body to maintain the right form. So if you do not, do the strength training or ignore strength training, then obviously your form is not going to be right. Neither are you going to improve in whatever sport that you're doing. I mean, this could hold good even for swimming, or even if you were a cyclist or any other form of sports activity. So strength training, I think, is an absolute must. And I would say at least, a minimum of 3 days in a week, so that you give 1 day towards upper body strength training, 1 day for lower body strength training, do core strength or a functional training on 1 day. So 3 days a minimum is a week would be a minimum, I would say, for strength training.
That's brilliant, ma'am. Thanks for sharing that. So, the role of strength training, is it relevant for patients as well? Would you say the same to the patients about strength training and doing it?
Yes. So, when patients come to me now, let me tell you, not everybody is very gung ho about going off to the gym and start weight training. And there's a lot of misconceptions about weight training or strength training as such. So, there are a few things here. One is, especially if a woman is, I mean, if I'm talking about one of my patients, if she's as such not into any form of exercise, then I'm not going to at that point push her into strength training. At that point, I'm going to encourage her to just get onto her feet and start doing anything that she loves. And what I've realized is there's really no point in me giving them some kind of a set chart and saying that, okay, do this on Monday, do this on Tuesday. It won't work that way unless they are passionate about it or they put their mind to it. So what I tell them is give yourself, I mean, this is just your me time. Give yourself 45 minutes to an hour, which you will spend doing some kind of a physical activity. Now the choice is yours. You want to go for a run, you want to go walk, you want to pick up a cycle, you like swimming, you will go swimming, you want to join Zumba, yoga. The choice is completely yours. Just start getting active. So the first thing is get out from the couch and get on active. That's the first step. Now, let's say in 2 or 3 months back, now, especially if I'm talking about my PCO kids, the young adolescents, when they come back and, I mean, I give them a target. I tell them, okay, you do what activity you want. I want so many kgs lost. And usually I tell them, say, 5 kgs in the next 3 months if you can lose and come back to me. And they come back to me in three months. Let's say even if they've lost 2 kgs, I'm really happy for them. That's the first thing. If they've stuck to some kind of a routine, at that point, then I will tell them that also try and see if you can. I mean, again, especially during lockdown, I've realized you don't really need to go to the gym to do strength training. There is so much you can do just at home. I've been following an absolutely awesome routine of doing functional training with very few dumbbells that I have at home, or some therabands or a few things like that, and very effective workouts that can be done at home. I mean, that's something I really realized now during the lockdown. Otherwise, I would always, try and find time and to rush to my gym, which I realize is really not required now. So once they are on to some activity, then I would tell them, okay, now you should also start doing strength training because this will help you. Do it even twice a week, it would help. And strength training doesn't really mean that you have to, pump iron and, pick up 10 kg and, 15 kg dumbbells or something. But no, you could just do functional training, use your body weight, do body weight training, which is also equally good. Or rather, now we say that it's even better. So, yes, I would totally encourage, but then this is what I'm trying to say. The first advice I would give them is please get active. And then I give them the choice to do what they like to do, what fits into their routine. Because, it's very easy for me to say, go sign up at a gym. And let me tell you, most of the youngsters will go and sign up at the gym and then not go. So it's, the parents are spending the money, but then the kids don't end up going there. So there's really no point in trying to spoon feed them with what they should be doing. The point is to give them the idea that this needs to be done. It's good for you. And I am not going to give you any kind of medications to lose weight, no way. So you will have to do this and follow up back with me in 3 months, and then I'll tell you what to do next. But yes, strength training is definitely something I would advocate once they're active.
So, would this apply to obstetrics patients as well? Your patients that are coming in, the ladies that are coming, pregnancy or gynecology patients that are there?
My obstetric patients, yes. So one is that, like I said, I myself was very active during my pregnancy, and this is something I totally encourage. We do have antenatal classes and antenatal yoga and all that, which is also, there in the hospital, which the patients can enroll into. Now, I have women who, let's say, they've already been going to the gym or they're very active and then they got pregnant. So for those women, I tell them to continue. I tell them to step down a bit, maybe step down with their intensity a bit, but they can still continue. Light weights, they can still continue. As long as they're not having any complaints, they don't really fall into the high risk category according to me, then they can continue with their gym routine or strength training routine or functional training. Yes. Then when they anyway come on to do their antenatal yoga, there are a lot of exercises that the instructor gives them, which is also, which confirms to functional training. So yes, it helps. Yes, I totally agree and, advocate to my obstetric patients also that they should be active and continue to exercise.
Touch on a few myths and misconceptions that you have to deal with left, right, and center, daily life. What do you see? What do you have to? How do you deal with them? Please talk about that too, please.
With the young adults, I don't have so much of misconceptions. As such, the main misconception being when I tell a youngster that you need to lose weight, and if you're talking about something like PCOD, it's a known fact that even if they lose 5% of their present weight, their hormones will start, getting into the balance that we want it to. So I just give them that 5% number. I don't even talk about weight to height ratio and this is where you are and you need to reach there. Because that will be a very large gap. It will be looking like something like 20-25 kgs loss. And you tell them that in the first consult, they are just going to run out of my door. They're not going to come back to me. So I don't even give them that figure. I tell them just 5%. 5% is all I want you to do. And what also happens, there are two questions these girls ask. One, doctor, can't you just give me some tablets, some slimming capsule and I will lose weight? So I say no. A big no. I am not going to do any of that. And then the next question they have is, okay, can I get on to XYZ diet, this, that, whatever. So again, there, my advice to them is, see, I'm not saying diets are wrong, but then don't get onto a fancy diet which you can't really stick on to, because a fancy diet can be very restrictive, and a restrictive kind of a diet, maybe you could stick on to it for 4, 6, 8 weeks, but then beyond that, you're going to give up that diet and then you're back. So this is where they think that they don't need to exercise and they can fix this with a diet. So this is one misconception I totally try to bust, and I tell them that no, the physical activity has to be as much part of your dieting. I am not saying that just because you start being physically active, you can eat whatever junk you want to. No, that is not how it works. But you will have to do both. You will have to have a balanced diet and exercise, and only then we are going to reach the goal that we are looking at. So this is one thing. Then coming to my pregnant women, forever, I think we've always thought that in pregnancy the woman should be eating for 2 people, and there are a lot of cultures where they'll say eat a lot of ghee and eat dry fruits. None of these are bad, but just the quantity in which you eat should be obviously, there should be some kind of a portion control. So again, there are a lot of misconceptions about exercising during pregnancy. They are scared. They are scared about miscarriages. They are scared about preterm contractions. Now, I'm not saying that exercise is for everyone in obstetrics, especially my practice. We see a whole load of high-risk pregnant women. Now, even in high-risk pregnancy, barring 3 or 4 conditions or indications, most of them can exercise, at least a low-grade exercise. Go for at least an evening walk or a morning walk, whatever suits them. So there are very, very few conditions in pregnancy where we would actually tell them that no, you need restricted activity. Very minimal conditions rather. So yes, I encourage them that they must get active because it's going to help them. It's going to help them with their delivery also. So that is where the misconception about exercise and pregnancy is. And then moving on, when we look at women who are getting into perimenopause, 40 plus, 45 plus, they're absolutely scared. Now, they are all now at the age group where their metabolism is kind of slowing down a bit. And so they tend to start gaining a bit of weight. And then they come to me saying that I'm not eating much, but then I'm gaining weight. Okay, why don't you start exercising? Why don't you do something? No, I'm scared. What will happen to my knees? I will get into osteoarthritis and osteoporosis. So there are a lot of misconceptions. And again, they would not want to do anything more strenuous than maybe a walk or yoga, because they think anything more than this is going to totally mess up their joints. So yes, there's a lot of counseling that is needed in that area also, where I need to tell them that perimenopause or postmenopause, they should, they can do whatever exercise that they want to. They want to get into running, swimming, or play a game of badminton, whatever. I mean, many women at that time have a lot of, I mean, at that point in age, have a lot of time in their hands. So I tell them, no problem, go on, start doing what you missed doing all these last 10, 15 years. If you wanted to run, you wanted to get back to your badminton, go ahead and do it. Nothing is going to happen to your, bones and joints. And it takes a lot of counseling, a lot of time spent with them to help them understand. But once they've understood, they're okay with it. And I think it helps because they see me doing it. I'm 50 now, so they know that if I'm doing it and I'm sitting in front of them, hale and hearty, and they can do it too. So I think it helps that way.
Excellent, ma'am. Now, coming to ladies, who think that size zero is the perfect size or can never be thin enough. And what it leads to is eating disorders. It leads to bones being weak. It leads to periods being all over the place. Now, in cases like that, what suggestion, what advice do you have to people like that? And they're very, very active, right? So they're not eating enough, exercising a lot. What do you have to say to them?
So, see, as the saying goes, extreme of any sort is obviously not the right thing, right? So, we do see, I mean, I do have a lot of athletic women. I mean, my hospital, one of my hospitals is very close to the railway, recreation club. So a lot of railway athletes, they come to me, and yes, they have a whole lot of issues with their cycle irregularity and all of that. But then this is where, so the balance has to be struck, that they are because they are so very athletically active, then which also means that their diet should be taken care of. And somewhere, something goes missing, and then that's how that happens. Other than that, I mean, the athletes would still, listen to you, because they obviously are the ones who are as such healthy, and they would want to make things right for themselves. But the difficulty comes with the girls who are into anorexia nervosa, because then there is a psychological issue also that we need to address. Especially with the size zero concept, which came in a few years back, and at that point, yes, there are a lot of these absolutely emaciated looking girls who were into a lot of dieting and a whole lot of fad diets, which doesn't really serve the purpose of giving you all the nutrients that your body needs. And these are the girls, and they get into amenorrhea and cycle irregularities and patterns of that. And here, just a simple counseling will not help. I mean, as much as I may spend time counseling them, they may still sometimes need a psycho counselor to help them through that phase, and help them understand how they should be treating the body.
Ma'am, it's been an absolute pleasure having you and chatting to you about things which probably a lot of people just totally dodge. So thank you so much. Really appreciate having you come over and talk to us candidly.
Thank you. Thank you. It was lovely being with you.
Thank you all for watching yet another episode of Movement Medicine. Please click here to subscribe to our channel. Please click here to watch other videos from our podcast. And looking forward to seeing you guys with the next episode very, very soon. Till then, keep smiling and smiling, folks.